So I started my journey in UHS as a qualified clinical physiologist. I was a band 5 over 10 years ago now, and after that, 3 to 4 years later, I became a band 7, and after gaining some experience in the advanced clinical skills. And now I have recently done the STP equivalence and managed to get clinical scientist status. In neurophysiology, we don't actually have a typical day. We're very fortunate in that our manager is able to rotate us in different diagnostic tests, which means that we see different patients, inpatients and outpatients of a variety of ages, from neonates to the elderly, which is really rewarding in some senses because I get to interact with different people of different ages, and some tests take longer, so you actually get to have a chat with them as well. And my main responsibilities are looking at, so I'm a clinical lead in EEGs. I also do some surgical related diagnostic tests, and then I'm in charge of the education and training of our department, so I get to do a few things. So when I started or looked at jobs in various places, I looked at UHS, and it was a tertiary neurological centre, and being somebody in nerves and brains, I was very keen to come here because I knew that complex patients would come here, which would mean that it's a high standard of care that we give here at UHS, which over the years I have noticed that we are very keen on giving that to our patients, which means we're always looking to expand services, but also making sure that we're working with the standards and as research comes along as well. So if anyone is interested in working in neurophysiology, then there's 2 ways that people can do that. There is a BSc training program as well as an MSc training program. So they can come in through those routes and learn neurophysiology. It'll be an on-the-job and university placement, so you'll be hands-on as well as learning all of the things online or in person. Also, if they are interested, any patient experience and customer care experience would be very beneficial, because that would show that they're very good with patient interactions or people interaction, which would help them. I don't think I have exact steps, but I would probably like to see neurophysiology grow a bit more, see a few more new services developed, and us just working towards up-to-date standards, see what's going on in the neurology world and in the neurophysiology world to see how we can improve patient care by looking at innovations and everything else.